In Kenya, 5,200 women receive a cervical cancer diagnosis annually, with the disease claiming the lives of 9 women daily due to complications. Health experts strongly advocate for the prevention of this burden through widespread HPV vaccination among girls. At Mukaweli Primary School in Kanduyi constituency, Bungoma County, an initiative is underway to vaccinate girls in the institution.
We are doing HPV vaccination to girls between age bracket of 9 years to 15 years. Mary,
not her real name, is a Class 8 student. She shares her understanding of the vaccine's importance in preventing cervical cancer, emphasizing the need for early vaccination.
I know the HPV vaccine helps to prevent cervical cancer. If they don't get the vaccine when they're young, they might grow and then they get the cervical cancer and they might die.
Mary is not the only student championing for the vaccination of young girls.
HPV.
Stella, a grade 4 student, is urging parents to embrace the HPV jab for their safety.
If you will be vaccinated, cancer will go away from you. You will be safe.
With 99% of cervical cancer cases attributed to the HPV virus, which spreads primarily through sexual intercourse, experts stress the importance of vaccination.
Also, having multiple children starting early, it is not good, because then you have persistent HPV infection.
It will prevent cancer at this early age, so that when they are predisposed, when wakifika age of 30 or 40, the chances of getting cancer will be reduced.
According to the Ministry of Health, shockingly in Bungoma County, early pregnancy rate stands at 19%, surpassing the national average of 15%, indicating a high rate of teenage sexual activity in the region.
Starting your sexual debut when you are a very young girl, you are at risk of contracting this HPV.
And despite efforts, HPV vaccine uptake in Kenya stands at only 60%, 30% lower than the WHO recommended rate. Globally, the first HPV vaccine became available in 2006. In 2019, after a pilot in Kitui County, Kenya rolled out the vaccine nationwide as part of the routine immunization schedule for girls aged 10 to 14 years.
Watoto wangu ni asset yangu ya kwanza.
It is for this reason that parents like Bonventure Wanjala has ensured that his 2 daughters have been vaccinated.
Tumepoteza wazazi, tumepoteza majirani kwa sababu ya kansa. Kwa hivyo mimi niliona ni vyema wakati serikali imetoa kwamba kuna chanjo dhidi ya kansa, nimeona ni vyema watoto wangu wachanjwe, ili nisije baadaye nikasema ningejua.
Teachers have also not been left behind in the fight. Jacqueline Kwambuka, a teacher at Mukaweli Primary School, lost her sister to breast cancer and now champions for frequent screening to ensure early detection.
When she went in for screening, we realized she has gone to stage 4, of which was so much irreversible. If it was stage 1, at least even the breast could have been cut off.
With the Kenyan government aiming for 90% HPV vaccine uptake to reduce cervical cancer cases, the hope is that the campaign saves lives one vaccine at a time. Ben Kerera, K24, Health Beat.